one of my colleagues, social scientist Will Courtney, the author of the book Dying to Be Men. He says that men have greater socioeconomic advantages than women. But despite these advantages, men on average are at greater risk of serious chronic disease, injury, and death than women.
And yet all we talk about is the advantages. The male advantages in the workplace. We talk about male power. We talk about lack of discrimination against men or less discrimination against men than women. We don't talk about the dark side of those statistics.
Exactly.
And across the board, you look at incarceration, addiction, domestic violence, gun use. You look across the board, even including COVID deaths. Talk about that for a moment, with how those statistics look.
Well, let me get to that, but stay on the statistics. That the Department of Health and Human Services has shown that 14 out of the 15 leading causes of death and disability, 14 out of the 15 males have higher death rates and disability rates. Men are more likely than women to use almost all types of illicit drugs than are women. Incarceration, you mentioned, 93.2% of prisoners are male in all the different jails and federal prisons. And as you mentioned, COVID is a higher degree of both disability and death in males and females. And again, statistics, hard data, a large meta-analysis study published in the Journal of Nature, over 3 million people who got COVID, who were diagnosed with COVID, equal numbers of men and women get it, but the statistics show that almost 3 times the odds of requiring intensive care admissions for men than for women, and the much higher rates of death in men than in women.